Chapter 30, Therapeutic Diets, page 247. So a therapeutic diet is a qualitative or quantitative modified version of a normal diet with we are aiming to achieve the same caloric rate, but the variations, okay, in terms of its consistency, in terms of how we are feeding the patient, okay, that is tailored to meet the client's requirement, to meet the patient's requirement. Usually, people who already work in a clinical field, those who are already doctors or physical practitioners, okay, only they are allowed to indulge in therapeutic diet. If you do not have the background, if you do not have the medical background, you are not supposed to practice into therapeutic diet. Okay, so those who are from the medical background here, they can practice this, they can become a clinical nutritionist. Okay, but apart from those who are not from the medical background, those who do not have the at least the basic of MBBS degree, okay, or any other allied like PHMS, okay, Ayurveda, homeopathy, okay, they can also practice therapeutic diet. But apart from that, others are not supposed to practice it. You can definitely have the knowledge of it, okay. So specifically, the clients, the patients who are admitted in hospitals, okay, inpatients, people who are admitted in hospitals or who are chronically ill, even if they are discharged, they may be put on specific routes of nutrition for the rest of their lives. Okay, people who have bowel surgeries, okay, intestinal surgeries, and they are put on certain types of parenteral nutrition. Okay, we'll see that later. Enteral nutrition. So first is your immunonutrition. Okay, here the focus is to improve the immunity. Okay, people who suffer from multiple organ failures or who are afflicted with multiple illnesses, specifically HIV patients. Okay, AIDS patients. Okay, we do focus on immunonutrition for AIDS patients. Okay, so and extreme age, for example, small babies in the neonates. Okay, kids who are admitted in NICU, neonates, okay, or geriatric patients, okay. So these are the target demography for immunonutrition. So, and also the patients who have been put on some invasive medical devices like ventilator or infusion pumps, injection pumps, okay, for a pretty long time. Okay, they have been put on central line. Okay, like when you go to hospital, you get an IV. Like if you're admitted in hospital, you get the IV fluids through the peripheral arteries. Okay, central line is directly into the main artery systems of your body, main venous system of your body. Okay, so people who have been admitted in chemotherapy units for a pretty long time, oncology patients. Okay, so in all these patients, we target them for immunonutrition. Okay, so the diets here will have some specific components. Okay, the diet should be rich in arginine, glutamine, omega-3 fatty acids, nucleotides. In your textbook, they have not mentioned about omega-3 fatty acids, but other sources they mention omega-3 fatty acids as well. Okay, so arginine is an essential amino acid. It's a protein source. Okay, important to maintain your body's homeostasis so that your body is not too acidic, your body is not too alkaline. Okay, somewhere in the between, that is which is considered as healthy. Okay, and whenever you are in a stressful situation, this fluctuates your body's acidity and alkaline nature. It fluctuates to bring it back into the homeostasis. Only then your immunity can function well. Okay, immunity functions well when the body is in a state of homeostasis. Okay, so for that, arginine is used. And also, along with all the other protein supplements, okay, any protein sources, protein is the only macronutrient which has the nitrogen ion to it. If you look at the skeletal structure of any protein, okay, it has the nitrogen ion to it. Okay, so arginine provides that as well. People who have pacemaker, their immunity is not much afflicted. Okay, because it's a lifestyle disease. Okay, because of a lifestyle diseases, they must have been put on pacemakers. But otherwise, they can follow an antioxidant rich diet. But immunonutrition is not targeted for people with pacemakers, because pacemaker is not an invasive device, right? Once it is in, it is in. Then it is not open. For example, in central line or ventilator, okay, some external device is been put on into the patient. So there is a high chance of infection happening. Okay. So pacemaker is something that stays within the body. Okay. So there is less chances of infection. So any device which, for example, chronically ill patients who are put on catheters, urinary catheters for pretty long time, okay, high risk of infection. Post surgery, high risk of infection, okay. Then coming to glutamine, again, it's a non-essential amino acid. It will give you the nitrogen component. So whenever you are wounded, you have multiple organ failure, you are under severe stress, because multiple organ failure means the body is under severe stress. Okay, so glutamine supplements are given here. It has also seen that the mortality rate, the death rate, reduces drastically in septic patients. Who are the septic patients? Patients who are not afflicted with just one form of infection. Okay. Infection means what? You got infected by this virus or that bacteria, this fungi. Any one kind of microorganism has infected you. Okay. But in sepsis or septic patients, different types of viruses, bacteria, or fungi, a combination of all these could have caused an infection in you. So that's a septic patient. Okay. So in such cases, to prevent multiple organ dysfunction or multiple organ failures in a septic patient, glutamine has shown improvement. Okay, glutamine supplements have shown improvement, but it has reduced the mortality rate as well, death rate of septic patients as well. Septic patients are a serious case. Okay. Yeah, gangrene could also turn septic if proper care is not given. Gangrene, usually most of the gangrene cases in diabetes are septic. Okay. Then we have nucleotides. Nucleotides help in the repair of your DNA and RNA. Okay, so they also because of the presence of these nucleotides, RNA and DNA is being built in your body. Okay, and with the building blocks of RNA and DNA present, definitely your body will be able to build more immunogenic cells as well. Okay, so in the absence of nucleotides in the diet, DNA and RNA repair won't be possible and your immunity will be compromised. So giving nucleotide supplements will make sure that the repair of DNA and RNA is onto the point and your immunity is not afflicted. Okay. So potential effect of on inflammatory responses, specifically after any surgery. Okay. Because surgical site infection, that is also another high healthcare acquired infection. Okay, HCAI, we call it as healthcare acquired infection. When you went into the hospital, you didn't had such issues or infection. Okay, but staying in the hospital environment gave you a whole lot of infection. So that is what we call as a nosocomial infection or healthcare associated infection. Okay, getting admitted in a hospital and within 48 hours, new infections are seen in your body, which was not there at the time of admission. Okay, so post-operative infection after surgery. Okay, after surgery, if the patient acquires an infection, definitely that was given to the patient by the hospital. Okay, not giving proper care or any external or internal causes that could have led to infection. Okay, in such cases also we focus on immunonutrition. And the primary conclusion here is to reduce the post-operative morbidity rate. Okay, the rate of infections that is growing in numbers in all the surgical cases. Okay, specifically after the surgery. Okay, to bring that low, because if your hospital is seeing a steady rise in post-operative infections, which means your quality of services is deprived. Your hospital is not giving good quality services. Okay, the rate of increase or decrease in the hospital acquired infection is a key quality indicator. Okay, it indicates how good your hospital performs in terms of patient safety and care. Okay, so if there is a high rise in post-operative morbidity rate, it means your hospital is not giving a good quality services. Okay, so just to bring these critical to make sure that you are in line with key indicators of quality, you focus on immunonutrition for your patients. This is done specifically on patients who are admitted, who are in hospitals under the care of doctors and surgeons. So coming to hospital diets, so usually it will start with clear fluid diet. Okay, soon after the surgery, etc., the patients will be given a clear fluid diet. Okay, slowly when you see the recovery happening, they will be put on full diet, full fluid diet, then soft solid diet, and then slowly by the time they are able to be discharged, okay, they are okay to be discharged. They you see that if the patient can be put on regular diet now onwards, it's high time that the patient can be discharged from the hospital. Okay, so that this is how the flow chart of the hospital diet goes in. Arginine is an essential amino acid. Okay, arginine is an essential amino acid. Proteins, when you further divide proteins, you have essential amino acids. What are proteins? They are actually blocks made up of amino acids. Okay, proteins are blocks made up of amino acids. So amino acids can be further classified into essential and non-essential. Okay, so arginine as a supplement, it is available only through food sources. Your body cannot make arginine on its own. That's why it is an essential amino acid. Okay. So coming to clear fluid diet, it can give you 300 kilocalories. There is no protein here in clear fluid diet. It is made up of only clear fluid and foods that are see-through. Okay, and they are given at room temperature. Clear broth. Okay, broth can be vegetable broth, bone broth. Okay, mutton broth, etc. Tea without milk. Tea without milk. Black tea, black coffee, strained juices. Okay, so they all come under the examples of clear fluid diet. So like when you are feverish, okay, when you have attained an infection and when you're feverish, when you don't feel like having anything that first day, okay, even when you are at home, you will be put on the something clear fluid, okay, some rice water or some fresh fruit juice or glucose water. Okay, so these all are clear fluid diets. But the day one of your fever, milk or curd, everything is avoided because they have protein in it. Okay, so that is avoided because the body requires high energy at this time. Okay, so that carbohydrate is the focus with clear fluid diet. Okay, so it can give you 300 kilocalories per serving, no protein. Yeah, mainly you should not add any protein in the clear fluid diet because protein metabolism requires a bit of time by the intestine, by the GI tract. Okay, and when the patient is recovering, you do not want the patient's energy to be lost in digestion. Okay, so when you put the patient on clear fluid diet, the body is not having a stress of digesting this clear fluid diet. Okay, and it does not form any gas or it is not irritating to the stomach or the intestine, so the patient will not suffer from bloating or any uneasiness in the stomach while the patient is healing or recovering. Okay, see, broth means vegetable broth as well as bone broth can be made up of chicken bones or mutton bones. Any red meat bones can also be used to make a bone broth. Okay, that is for non-vegetarians. Vegetarians can go for vegetable broth. Okay, you can search in YouTube how to make a vegetable broth, very easy. Okay, you just have to boil the vegetables together, remove all the vegetables, whatever fluid is remaining, only that is given as vegetable broth. Okay, You can add some cinnamon or some cloves into it just to add the flavor profile, but don't add pepper or chili into it because those are irritants. Okay. Like spices like cinnamon and cloves, etc., they won't irritate the gastric lining much. Okay, just to enhance the flavor, you can add cinnamon and cloves just a bit. Next, coming to full fluid diet. So here, the full fluid diet, it bridges the gap between clear fluid and soft diet. Okay, 1,200 kilocalories can be expected here, and 35 gram of protein is the target throughout the day. Throughout the entire day, 35 gram of protein, 35 gram of protein, not per meal. Okay, throughout the entire day. So it is frequently used as a middle step between when you want to do a transition, when you want to transition from clear fluid to solid food. This is the ideal way to go for. Okay. So the second day or the third day, the patient will be put on full fluid diet. All food that is given are liquid in form. Okay. And here you can add a bit of protein as well, because in terms of milk or curd, okay, 35 grams of protein, that should be the limitation. So here you can give tea which has milk in it, coffee which has milk in it. Okay. It provides more calorie as compared to the previous one, clear fluid diet. It is still nutritionally inadequate and should be used only for short periods of time. You cannot make the patient be dependent on full fluid diet for a week or a month or so, because it is not nutritionally adequate. Okay, just to do the transition, remember that, just to do a transition from clear fluid to soft diet, we will stick to full fluid diet. Okay, when you see the patient is able to keep the food in the stomach, the patient is not vomiting, there is no aspiration. Okay, the patient is able to pass stools, motion is okay, flatulence is also present. These all are good signs that, okay, you can go to the next step, that is soft fluid, a soft diet. So coming to soft diet, 1,500 calories can be given in soft diets. Protein intake can be increased here. Okay, 35 to 40 grams of protein can be given. It is very similar to regular diet, but it requires very less of chewing. Okay, it requires very little chewing, and it is ready to digest. Your body, again, your body does not have to bother about digestion much. Okay, avoid any hard meat, red meat, coarse cereals, multigrain cereals, okay, which has a lot of fiber in it. Okay, avoid those items here. Raw fruit and vegetables, again, we are trying to avoid fiber here. Okay, it is mainly used following a surgery or when the patient is recovering from infection. Soft diet is used. Anyone who is suffering from digestive disorders like IBS, etc., and who has chewing problems, okay, but they do not have swallowing problems. They just have chewing problems, but they can swallow well. You will put them on soft diet. Patients who can't even swallow, especially after the any neck or throat surgery on ventilators, okay, tonsillitis patients, severe tonsillitis patients, or any surgery that has been done on the esophagus, mouth, jaw, okay, removal of tumors or mastectomy has been done, etc. In such cases, the patient will be put on NG tube, that is nasogastric tube. Okay, swallowing is the issue, then the patient will be put on nasogastric tube or other forms of enteral nutrition. But if the patient is just having the chewing problem, okay, does not have the energy to chew, swallowable foods can be given. Like your khichdi, fluid khichdi will come under soft diet. Mashed potatoes, okay, mashed khichudis, mashed boiled vegetables, etc. They all come under oats. Okay, avoid multigrains, avoid whole fruits and whole vegetables here, just to remove the fiber factor from the diet. Yeah, all kinds of porridge is soft diet. Creamy soups that are creamy in nature, that will also come. Cream of tomato soup, cream of corn soup, baby corn soup, okay, they will also come under soft diet. Here you can add a bit more spiciness as well to enhance the flavor and taste profile. Then the last one is your regular or normal diet, easily digested, maximum nourishment uh, is available through the regular diet, balanced diet. Okay, minimum effort, it is well balanced because you are aiming for a balanced diet. 1800 to 2000 calories can be maintained. Increase in the protein intake. Like how a regular diet will have the protein component to it, you have to follow the same based on the patient's vital statistics and body measurements. So regular for normal diet, maximum it should give you 2000 calories. Otherwise, if any diet is giving more than 2000 calories, it is integrated with some other purposes as well. For an average adult's requirement, whoever is sedentary, average adult who is sedentary, okay, 2000 kilocalories from a regular diet, normal diet is okay. Okay. So you have that breakfast option here, midday snack, lunch option, afternoon snack, and dinner option. Okay, so 5 meals a day can be given, and the intake of total fat, sodium, carbohydrate, protein is also given in this pie chart. You can take a screenshot of it for later reference. Next, coming to nutrition support service, this is seen in a hospital. Okay, this is not from a clinical point of view as like a private clinic. It is from the hospital's point of view, because what all things you see in the periphery here, the outer hexagon, octagon, what you see here, these are found in a hospital, not in a clinical services. Okay, like your CSSD that comes under sterile services, finance, administration department, etc. So they are not linked to direct patient care. Okay, but they are linked to the center of patient care, that is your doctor, dietitian, nurse, pharmacist. Okay, so they form the healthcare team, healthcare/nutrition team for the patient. Again, we are focusing at a patient-centered care these days. Okay, earlier days that was not the story. Earlier, what the doctor recommends was what the patient has to do. But now in today's healthcare, we do take patients' choices, their comfort level, their options of treatment into consideration with whatever you want to do with the patient. Okay, treatment options are given to the patient. They are given the understanding of the pros and cons of all the options. And the patient here is again a main character who can make major decisions. Okay, the other services like the clinical nursing services, dietitian, and pharmacists, they have to take into consideration what the patient likes and dislikes while giving a service. Earlier days, 10 years back or 20 years back, when you think about the healthcare system, it was not the case. Okay, something was prescribed and the doctor and the patient has to just follow through. Okay, but now patient is a key decision maker in their own, about their own health, and also about what kind of treatment the patient wants. So you as a dietitian and a nutritionist, you also have to follow the same thing, same ritual in your practice as well. So subjectively, what your patient likes, dislikes, what they are allergic to, what they are not tolerant to. Okay, so these all principles and ethos has to be considered when you are making a diet plan for them. Specifically, the dietitians who have a medical background, who will be working with the healthcare team in the future. Okay, so that's your nutritional support service in brief. Next, coming to special feeding methods. You have enteral feeding and parenteral feeding. So enteral is you will use your GI system only. Okay, you will use different parts of your GI system to introduce nutrition for the body. Okay, either orally with tube feedings, or directly you will do a surgical incision over your stomach area, reach to your jejunum, duodenum, okay, whichever part of the intestine, and directly you will have to give supplemental nutrition to that part of the body. Okay, so when you are using the means of your different parts of your GI tract to introduce nutrition Okay, not just food, we can't say food, but introduce nutrition into the GI system, directly into the GI system. That comes under enteral mode of feeding. Next is your parenteral. Parenteral is when you use your circulatory system, okay, your vascular system. That is your veins. Okay, mainly veins are used here, and the people who have an inadequate GI function, even if you give them enteral nutrition, their GI system does not have the capacity to do the digestion and absorption. Okay, in that case, you are left with only parenteral nutrition. So directly, based on the osmolality of the nutrition prescribed by the doctor, like your DNS solution, okay, dextrose solution, okay, normal saline, all these things are given directly through veins to the patient just to maintain that nutritional status. Okay, so that is parenteral nutrition. So here you can see different modes. First, your enteral nutrition, liquid supplement or any nutrition is taken by a mouth or through a feeding tube. So first is your NG tube, that is nasogastric. So in your parenteral, you have nasogastric tube feeding, nasoduodenal, and nasojejunal. Okay, that means under a single tube of an NG tube can go directly to the stomach. So that is nasogastric. Okay, if it still extends, if certain variants of NG tube, if it still extends up to the duodenum, that becomes nasoduodenal. Okay, from nose to duodenal. Other variant where it will furthermore reach out up to the jejunum, that is nasojejunal. Okay, so these are three different types of nasal or oral feeding. Oral, we will usually not use oral, okay, because there are high chance of aspiration as well. Gag reflex may take place and it may lead to aspiration of the stomach contents. So we avoid oral, but usually we stick with nasal passage. Okay, the tube is inserted through the nose, and usually you will go for the left nostril. Right nostril is very rarely used because most of the patients, they may have polyps in the right nostril. So left nostril is usually used for NG tube feeding. Okay, so under NG tube, under nasal feeding, you have three types. One is NG, that is gastric, ND, that is nasoduodenal, NJ, that is nasojejunal. Okay, the name comes from where it starts and where it stops. Okay, if it stops in the stomach, it is gastric. In the duodenal, and jejunum, it is jejunal. Okay, then you will then next is surgical modulations, in which an incision is done, an opening, not just incision, an opening is done. That is why it is called otomy. Okay, otomy means you do a surgical opening. Okay, a surgical opening is done just above the gastric area, and a feeding tube is directly placed into the stomach. So that is gastrostomy, because you are making an opening in the gastric area, in the stomach area. Okay, then you have jejunostomy. You make an opening where your jejunum is, and directly a tube is placed into the jejunum. So this kind of tube feedings are done in patients who may have undergone esophageal surgery, okay, or any jaw surgery, jaw removal, for example, in oral cancers, okay, oral tumors or oral cancers, complete removal of or partial removal of jaw. In such cases, the patient will not be able to swallow or chew. Okay, so such patients will be put on lifelong enteral nutrition. Okay, so in those patients who have undergone jaw removal or removal of the esophagus because of throat cancer that may have spread to the esophagus may have been removed. Okay, esophageal cancers. Okay, in such cases, patient is put on gastrostomy or jejunostomy. Next, coming to parenteral nutrition on the left side, when you feed your patient through central vein, okay, directly into the superior vena cava. Okay, if you know if you remember the anatomy of heart, you have the superior vena cava that is on top of the on the anterior the superior side of the heart, and you have inferior vena cava down that goes into the heart from down below, but that is not used. You are trying to reach directly into the superior vena cava through your subclavicle vein, or usually you're using your clavicle veins. Okay, so directly into the superior vena cava you will give the parenteral nutrition. Otherwise you will use your IV fluids. Okay, wherever you can place your IV cannulas, through that you will give IV fluids as a form of parenteral nutrition. Okay, when you're using your IV lines, that is usually for peripheral veins on your hands, legs, elbows. Okay, wherever the nurse is able to find a vein, she will insert an IV cannula, and through that nutrition is given. Okay, so is it clear the difference and different types of parenteral and enteral nutrition? This is done only in clinical settings. These procedures are done only in clinical settings. Okay, those who are not from the medical background, for your knowledge, you can continue listening to this. Okay, what types of food are given here? Natural liquid foods, okay, broth, etc. These things can be given, not in parenteral, in enteral. Okay, in parenteral, it is completely based on osmolality, dextrose, electrolytes. Okay, that is parenteral. In enteral, natural liquid fluids like broth, clear soups, okay, millet water, strained fruit juices, because you have to strain. You do not want your NG tube to accumulate the debris, or any food particle should not get stuck in your NG tube. Okay, otherwise it will not it will cause obstruction. Okay, so make sure whatever is your choice of liquid food which you want to give through the enteral tube feeding, it should not have chunky pieces. Okay, it should not have big pieces or chunky pieces which may cause obstruction in the tube. Okay, am I audible to all? Then we have blantarized feeding. Blantarized feeding can be done for gastrostomy and jejunostomy as well. Okay, food items are whatever. Am I audible to all? Is it clear now? Okay, so the types of food given: natural liquid food, whole milk, skimmed milk, or milk, egg whites, eggs that are blend, like after you uh, blend the eggs well. Okay, eggs can be given. Strained water of rice, okay, rice water, or any porridge water. Okay, you water down the porridge and you use the water, use its water. Any molasses, sweet syrups. Okay, that's these things can be given as natural liquid food. And blenderized feeding. In blenderized feeding, you cook your food, like you steam your food, boil your food, boil vegetables, boil lentils, or your pulses or cereals, and then you blend it in a blender. Okay, nice. You will have to make it into smooth paste without any big chunks, without any hard big chunks. Okay, and that can be given into gastrostomy or jejunostomy. Okay, in NG tube feeding, blenderized food will be difficult to be given. Okay. Okay. So in blenderized food, when you give blenderized food, Natural liquid food, whichever food are naturally liquid in nature. Okay, like if you take egg, you blend your eggs well, it becomes liquid in nature. Milk, skimmed milk, rice water. After boiling the rice, the starchy water that is left. Okay, after you strain it. Okay, so these kind of items, pod-rich water, watered down pod-rich water, broth, clear broth. Okay, these are naturally liquid foods. Fruit juices, strained fruit juices, vegetable juices which are strained. Okay, cold pressed juices. These things can be given through NGD. Blenderized feeding is used for